Hello.
Nice to speak to you.
So I thought we would do this interview. I'm just going to ask you a few questions. I want to keep it short. I did want you to talk about how you came, the face height and how you came across how Oralift was invented and why.
All right. Uh, Basically, it was in the late 1980s, and I was interested in treating people with facial pain. And I was not getting quite the results that I wanted. So I developed a theory which was quite revolutionary about low facial height. And this technique then led me to develop what I used to call the dental facelift. This was where we used to replace low facial height by crowning all the teeth or making new dentures at a new vertical height. And this technique could make people look a lot younger. And while doing this work, I realized that because this was quite an invasive procedure, you had to make new dentures or you had to crown all the teeth. But the appliance that I was using to determine the low facial height, using it alone was also giving an anti-aging effect. Therefore, I said, why do all the invasive work when you can just use the appliance to get similar results? And that's when the Oralift started. I think it was about 2002 when I first developed the Oralift technique.
Yeah, so it's been around for a good long time.
Well, it's a very disruptive technique. It challenges how we do our dentistry. And when I first developed it, I wrote a paper about it, but the dentists, they still haven't taken this on board because it changes the way we think about how teeth meet, occlusion. And therefore, when it's a disruptive technique, and I used to teach dentists this technique, and they'd be very excited. They'd come over to my surgery, they'd do the course, very excited. But when they would go back to their own surgeries, they went back into their comfort zone of just treating teeth and not looking at faces, And also because I was a general practitioner and not from a university, the professors and whatnot were a bit reluctant to take my technique on, And therefore, that's why I decided that the best way for me to make this technique more popular is go direct to the public. Right. And that's what I did about 2 years ago.
Yeah, estheticians are very interested in this because we see it so much. We see the atrophy going on down here and the grinding. And isn't it true that when we grind over the years, over the decades, that the actual angle of the mandible starts to turn? And so we just get all this, everything just disappears.
That is true. That is true.
Yeah.
Facial aging, if you go back quite a few years ago, facial aging was just regarded as soft tissues sagging down. And then they started to realize, no, there were bony changes that were taking place in the maxilla and the mandible that were also affecting facial aging. But what I've discovered is it's not just the bony changes in the mandible and the maxilla, but also the fact that we're grinding our teeth down, we are losing low facial height. That is also a contributing factor to aging. So if you grind your teeth and clench, you are going to show more signs of premature aging. And the other thing that, of course, that I've found now is that posture plays quite a big part in facial aging. You know how when we get older, we get the forward head posture?
Yeah.
And that can cause, that's right. And all these aspects can be changed by using Oralift. Do you still use Oralift yourself?
I do. I took a little bit of a break because I was doing Invisalign.
Right.
But yeah, I do. This is just another pair. Mine are upstairs. I do. I am going to get back to it because I'm my free space. I feel like it's starting to close up again or something. I don't know if that happens, but
well, It does. What I find is I've been using it for a long time now. And from time to time, I will find that if I'm getting very tense and my freeway space is starting to close because the muscles get tight, then I just know it's time to put the appliance back in and start using it again. So on an average, I do it not strictly according to what I prescribe, but nearly the same. About twice a year I use the appliance.
So we were talking about facial height and how, people, you were saying about facial aging, we lose fat pads, but bones change and
That's right.
the teeth change and
yeah, the maxilla sort of flattens, it goes into clockwise rotation, the mandible changes, teeth, if they get worn down, they change. Then, of course, the muscles change as well. The muscles atrophy as we get older, skin changes as well. But what we don't realize is that the body has the ability to adapt. And when the process of adaptation is kicked in, every cell in the body has to respond and to do the best it can. And that's what Oralift is triggering off, the process of adaptation. It's very powerful.
right, because it adapts in a bad way, and so when you add the Oralift, it adapts the other way.
Well, yes, because
right.
aging means our body is adapting to the damage that's been done to the cells. The cells, because they accumulate all the waste materials that have been created over the years, become chronically inflamed. And therefore, our immune system has to adapt to allow the immune system shouldn't start attacking these damaged cells. So it has to adapt. And therefore, immunity goes down as we age. So, yeah, in a way, we adapt to the aging process. And now Oralift comes in and says, no, stop. You got to really change and adapt to something new. And adapting to something new is the positive way, and we get the positive changes from that.
Nice. So I have a ton of before and afters, people using the Oralift, but what can people expect the first couple of weeks with Oralift? I think it's interesting that people see changes even in the first month. A lot of people do, like my clients do.
Yes. When I was in practice and treating patients, I always used to take a picture 10 minutes after doing the initial fittings. And even after 10 minutes, you could see changes starting to happen because facial muscles, they adapt very, very quickly. And I didn't realize how quickly, because in orthodontics, we use this principle of facial muscles adapting by using various appliances, but I always used to think it'll take quite a while for facial muscles to adapt to a new position of the jaw. Wrong. They adapt instantaneously. And within 10 minutes, sometimes you can see changes. Within 2 weeks, I could more or less guarantee that I'd see changes in everyone within 2 weeks. But it's the long-term effects that are the most exciting, obviously.
Yeah, absolutely. Because I think very few people think about losing height in their face. They think about their cheeks sinking or their neck sagging, but they don't think about this part shortening.
That's right. And for clenching, people who clenched or grind their teeth, that really is quite dramatic. I don't know whether you know Claudia Rolnick. Yep. Mm-hmm. Well, she used to clench quite a lot. And I saw some pictures of her when she was much younger. And she had quite an oval face. But you saw how that face had changed over the years. And I've seen this over and over again in many patients when I used to treat patients myself. Yep.
Yeah.
But that is, but Oralift is not just for people who clench, though.
Right.
Some people have a very long face, and they worry that using Oralift might make them look worse. No, that does not happen. People who have a long face, as they age, their face appears even longer because the cheeks flatten, the soft tissues sag, and therefore the face starts to look longer. But when they start using Oralift, suddenly, because everything is lifting back up, they'll find their long face doesn't look long anymore, or not as long, you know.
Right.
Don't make it into a square face, you know.
Right. And
But
there's improvements that look so natural because it's the muscles that are doing it mostly.
exactly, muscles and the power of the facial muscle. And facial muscles are unique. They are different from our body muscles. And we haven't really, you know, one of the things you said is why haven't more dentists doing it, or I was saying that. And one of the reasons is because the research that is needed into the power of the facial muscles to adapt, we need to do a lot more research, and research costs a lot of money. And that is probably one of the reasons why Oralift hasn't become as popular as it should, but given time, it will.
There. I would say in the last 2 years, you guys have been on fire. I mean, as people find out about you, you know, because it's, well, I can say that Jane was trying to make her own Oralift because she didn't know you existed, and then she found you, and she was ecstatic, you know, Jane Man. So yeah, I mean, there is such a need, and I can release my clients' jaws to the cows come home. But if they need this appliance to open up free space and make their face a little longer and pop their bottom third back out, they need it. You know, I can't do that in a month, once a month, you know.
No. The other thing is, you know, people get worried and they say, oh, can I do other treatments with this Oralift? Yes, because Oralift is like the foundation. If you've got good structure, muscles, good skin and whatnot, then anything else you add onto it is only going to be beneficial.
Yeah, I have seen people do so much to their face, and then they finally add the Oralift. I'm like, you need the Oralift. I think you need the Oralift. You need the Oralift. They finally add it, and it's just like everything they do blooms. Their face all of a sudden looks amazing because they're getting they're getting extra blood supply to the face. You know, that's golden when we're trying to rejuvenate things. So it seems simple, but it is complex, but it's just such a beautiful, easy to access solution for this type of facial aging. Well, all facial aging, I would say.
That is right. That is true. Very true. Very true. When I was in clinic, I had my clinic in London in one of these streets, which was the center of the medical treatments, you know, and cosmetic treatments. I used to get patients who were having other treatments, and they were having regular Botox, regular this and that. And suddenly they'd start with Oralift, and suddenly they'd say, what is happening, you know?
Yeah. Because I try to explain it to people. It's like it just opens up extra circulation that your face has not seen for a while, you know, and that sort of slowly closes down as we grind and grind and grind. And then you're saying, okay, here's a breath of fresh air. Here's some new blood, and everything just takes on. Everything you've done to your face, you'll suddenly see it. It's good stuff.
Christine, the best thing about Oralift that I find is, not does it address your facial aging, but the health benefits that you benefit from are also tremendous.
Yeah.
So many. It helps with breathing, you know.
Breathing.
It helps with their posture. Posture improves the circulation. The circulation to the facial muscles doesn't just stop at facial muscles, it goes to the brain as well, so your brain benefits from it. So the benefits, the more research we'll do, we'll realize how beneficial Oralift is.
Yeah. Yeah, it's fascinating. It's a fascinating subject. That's well, right. We're going to insert some before and afters here. And then there was one lady that actually and I want to find her picture. I think it's on the Oralift website, where she had a chin implant, had it taken out, used the Oralift, and had better results from
That's
using
right.
the Oralift. I thought that, I just love that one. There, you guys have a lot of before and afters on your website, but
Yes. I
we're going to be posting some
yeah.
here.
I don't
There's
know
just,
whether I've got it on the website now, but I used to. This treatment's been going on for such a long time, but I remember the one that you're talking about. She had the chin implant and she took it out, and her retruded jaw, which used to be very retruded, looks better without the chin implant. Yep, I remember her now. Can't remember her name, but I do remember that.
we remember the faces, yes.
That's right.
So what can users expect? I mean, it takes, what would
I
you say?
think,
I know
I
that
think,
max results happen at 3 years, but they continue forever, really, as long
yeah.
as you use.
I think the most important thing is people get very obsessed that there's a certain way of using Oralift that's going to give them the best results. Now, if I knew the answer to that, I'd be delighted. There's quite a lot of research done. I think the most important thing is don't get obsessed by the program that we have devised. The important thing is to wear the Oralift and listen to what's happening to your body. Because aging has made our skin deteriorate, the collagen is not as much, the elasticity is less. Therefore, if you try to do too much, you might find that your skin temporarily may look worse. Therefore, listen to what's happening, take regular pictures, and don't get obsessed by doing absolutely the right thing. Just use the Oralift.
I see it. Well, that is the beauty industry. I can tell you, we get a little obsessed, but it is what
right.
it is.
That's right. But
so I know you guys are having a sale at the end of the month, and we're doing this interview in honor of that sale to announce it. Is there anything I haven't asked you that you want to talk about?
We could go on about the benefits of Oralift, but if you do, then it starts to sound like snake oil. It can't be true. But there are so many benefits. And what I'd like people to know is if they notice anything unusual that is happening, which is good, they should report it on the app. It's only by listening to people that we can then formulate what direction best to take for further research. So if they notice anything, an unusual thing that may be happening, they should report it, because by listening to clients, that's the way we can take things forward. There's a big movement in medicine now, where they listen to their patients and then formulate their research according to what the patients are saying. In our universities here, Birmingham is one of the leading authorities in that. And I was going to do a clinical trial with them, but we didn't get the funding, so it'll come.
Yeah. On the flip side, though, I hear that your customer service is fantastic. Clients tell me all the time that your customer service is really, really good. So,
well, with a new treatment like Oralift, we have to make sure that people are unsure of so many things that our customer service has to be, and that's our priority. In fact, what we have done now is, we got the app that goes with Oralift. And once people have done the onboarding, they come to their final bit dashboard, which is the area they come to every time once they've finished their treatment. There, we are giving them a free Zoom appointment. So if they're unsure about anything, they can join us every Monday on the Zoom with a Zoom appointment.
oh, wow, I didn't know that. That's fantastic.
Yeah, that's just recently. We have only started it a few weeks ago, because there were so many people asking questions. Have I done this right? Is this correct? I said, let's let them ask face to face rather than by just emails. Emails are a bit impersonal. But if you can talk to someone face to face, it's so much more like the Zoom is still much better than emails. It's not the same, I feel, like going to see a real esthetician or a real doctor. There you get the one-to-one relationship, but Zoom is second best.
Yeah, yeah, and it's way better than nothing. I mean,
Right.
just going it on your own, because there are lots of questions with the Oralift. It seems so simple, but I'll be like, I'm glad they have good customer service because they're asking me questions I have no clue. I know the basics, I know the basics.
All they got to do is either email us or join us on that Zoom call every Monday. It's every Monday at the moment, and we have timed it at a time which is convenient for globally. So the appointments are UK time, 5 o'clock. So in your time, it'll be another 2 hours from now,
Right. So yeah, 5-6 hours ahead of us, depending on where you are.
Yeah.
But UK time, 5 o'clock on Mondays.
Yeah.
Beautiful. So those of you who have Oralifts and have questions, just jump on there.
That's right. That's right.
Get ready. Thank you so much, Dr. Nick. Is there any last words you'd like to say?
If you've got Oralift, use it.
Yes.
Don't let it lie in a drawer. It's like, becoming a member of a gym. And you say, oh, I'll go next week and the week after and the week after. No, use Oralift. If it's lying in the drawer, take it out, use it.
Right. Perfect. I love it. Thank you so much, Dr. Nick.
You're welcome.